This is my audience. To inform, my specific purpose is to inform my classmates about pediatricians. Do you have a pediatrician? How often do you see your pediatrician? Did you know that according to the College Board, there are 39,244 jobs in pediatrician and a growth rate of 5%? As someone who has a pediatrician and sees mine regularly, I can say that having a pediatrician is very helpful. Children typically see their pediatricians every 6 to 12 months. You can go to them when you're sick and not feeling well, or just to go for a normal checkup. Pediatricians are beneficial to the health of children. Today I'll be talking about pediatrician checkups, specialties, and their salary. Typical pediatrician checkups. According to the University of Rochester Medical Center's Pediatrician Encyclopedia, a pediatrician is a medical doctor who treats children. This type of pediatrician, a typical pediatrician is someone who does checkups with children. This type of pediatrician will diagnose and treat children. In the Gale Encyclopedia of Children's Health, Infancy Through Adolescence, written by Michael Mazzei in 2016, it states, "A pediatrician is a physician who specializes in the treatment of children from birth through adolescence. A pediatrician will do checkups with the same child till they are 18 or till 21. Children can also get new pediatricians based on their gender and when they hit a certain age." Now that we've talked about a typical pediatrician checkup, we can now talk about the different specialties. Here are specialties of pediatricians. When asked what's the best advice to give someone going into the specialty, Dr. Jessica Lloyd, in the article Dr. Jessica Lloyd describes an average day for a pediatric hospitalist at UCLA on January 11th, 2017. She says, there are so many pediatric specialties and different places to use those skills. So try to shadow as many of them as possible to see what we do and find your niche. There are many specialties in the pediatric field, such as neonatology, cardiology, surgical, and many more. Depending on your pediatric field, you will be doing different things and different processes to become one. According to the University of Medicine and Health Sciences, a specialized neonatologist is a specialized physician who focuses on providing medical care and treatment to newborn infants within the hospital. Neonatologists do the same thing as typical pediatricians, except they specifically work with newborn infants. Neonatal pediatricians do routine wellness checkups with children and infants until they're 18 years old. Now that we've talked about the specialties of pediatricians, we can now discuss the pediatrician salaries. In Job Outlook for pediatricians in the United States, modified in 2021, it says that the projected pediatrician job growth rate is 7% from 2018 to 2028. And pediatrician salaries have increased 5% for pediatricians in the last 5 years. There will always be a demand for pediatricians as childbirth continues. The demand can increase salaries depending on the demand of the area. According to ZipRecruiter, the average pediatrician salary in North Carolina is $177,345 yearly. In North Carolina, the salary can differ depending on the area, however, this is the average. The salary of a pediatrician can also vary depending on their specialty and what type of pediatrician they are. We've talked about what pediatricians do and their differing specialties and salaries. The early stages of development are all during children's adolescence. Pediatricians are impactful during these early stages of life. A pediatrician can help set a base foundation for both physical and mental health. To wrap things up, I'd like to challenge you to learn more about what your pediatrician does. Yeah, thank you.